Much attention has been focused this election year on the estimated 47 million Americans who have no medical insurance. Less publicized is the fact that more than twice that many have no dental insurance. Michelle Miller looking into the many problems they face as part of our series, The Other America.
When Harlem school kids can't concentrate because of a toothache,
have you been brushing your teeth every day, sweetheart?
This is where they find relief.
Let's brush away those cavity creeps.
For more than a decade, the Community Dent Care Network's mobile van has cared for the youngest of Manhattan's medically underserved.
The most common chronic disease in children is dental caries, dental decay.
When Dr. Alan Formicola was dean of Columbia University's dental school, school principals begged him to help kids in chronic pain.
If you look across the country, 51 million school hours are lost because of dental problems.
Today, the program he started includes the van.
How are you today?
And 10 clinics. Uninsured patients pay what they can or not at all.
You need dental care?
The van is for preschoolers, but mobile dentist Rebecca Schaefer says adults bang down her door for help.
We can't even begin to touch the need that's out there.
1/3 of Americans, 100 million people, have no dental insurance. Medicaid covers some children up to the age of 18, but only 9 states provide Medicaid dental coverage for adults. And most dentists don't even accept that.
Okay, would you head back, please?
As a child, Ronnie Edwards had Medicaid. At 23, after 5 years of not being able to afford insurance, his teeth were disintegrating.
He was missing some teeth. He had pain in the front area. He had a lot of broken down and discolored fillings.
I was afraid to floss, afraid that, oh my gosh, if I do, one of my teeth could fall out.
One team of Harvard researchers asked Americans across the country what their first priority would be if the U.S. had universal health care. Their most common answer? Their teeth. And those researchers told CBS News that a lot of Americans are taking their teeth into their own hands, literally, with pliers.
The easier stories were some of the older men I interviewed who had toolkits. Maybe men who had worked in construction when they were younger, so they could use pliers to pull out their own teeth.
Dr. Susan Sered says lack of basic dental care is creating a second class of Americans, disfigured by rotting and missing teeth.
And if they lose their job, they're going to lose their health care coverage. Lose their health care coverage, they can't take care of their health. Can't take care of their health deteriorates. Their health deteriorates, they become less employable.
She calls it the death spiral.
That's a big hole in the tooth.
Abscesses are common at the dent care clinics. They are excruciating and can be deadly. Take the case of Diamante Driver, a 12-year-old from Maryland, mistakenly dropped from Medicaid. For months, he suffered with a tooth abscess until the infection spread to his brain. He died last year. Doctors say a routine $80 extraction early on would have saved him. His emergency care cost tens of thousands of dollars.
It doesn't make sense because if you can treat dental disease earlier, the cost is a lot less.
Less, even with dentist fees rising faster than inflation. Dent care, on the other hand, has expanded to include underserved adults. Rebuilt Ronnie Edwards' mouth.
I just feel like a different person. I just can't stop smiling.
And is turning no one away. Michelle Miller, CBS News, New York.